Hi guys, this is Dr. Shannon Clark with Babies Up to 35. We are going to do some facts and myths about fertility over age 35. So I am waiting on Dr. Lora Shahine to join me. I don't know if she's... Lora, are you joining me for Pacific Northwest Fertility or are you joining me from Lora Shahine? I'm not sure which one she's joining me from. Let me see. Let me see. Oh, there she is. Okay, hold on. I'm going to add you. Hold on, Laura. There you are. I see you.
Hi.
I can't see you.
Oh
Wait,
no.
hold on. Wait, just wait. Maybe it's coming through. Do you have a good connection? It says waiting. I can hear you, but I cannot see you.
Oh shoot. I can see me. Um,
You can't see.
let me try one thing. Hold on
Okay.
one.
Mine says waiting for Dr. Laura. They say that we can see both of us, but I can't see you.
Oh, okay. Oh shoot. Well, you look fabulous.
Oh yeah, well, I
Um,
wore this for you.
oh, RBG, fantastic. Oh,
Okay.
I wore my uterus hat for you.
Well, I can't see it. Okay, you know what? Hold on. Just let me see something. Hold on. Hold on, guys. I'm trying to find her. I'm going to request her one more time.
Yay!
Yay!
Awesome. We did it.
I
We
just
are
had to, I had to
so
resend the request.
technical.
Okay, so listen, I want to get right to it because I have 19 questions.
Bring it. Ready.
Okay, so first, before we get started, tell us who you are and how they can find you.
Yes, I am Dr. Lora Shahine. I'm a reproductive endocrinologist in Seattle at Pacific Northwest Fertility.
Okay, and they can find you on Instagram at...
Dr. Lora Shahine.
Okay, perfect. So let's get down to it. My first goal is to get through as many of these questions as possible. So I may or may not have time to get through your all's questions, but I'm pretty sure there's going to be a part two. So, and the whole purpose is, listen, I'm going to dispel some myths. We're going to ask some tough questions here because I really think it's time, we need to do this every now and again. And we're going to talk specifically about after 35, fertility and pregnancy. So number one question that we got, and I went through your Instagram comments and mine. And one of the questions was, it seems that more and more women are struggling with fertility issues later in life. Has something changed? So first, is that true?
We're not sure. We are definitely seeing fertility rates decline throughout the world, and we're not sure if it is a societal thing or environmental thing, or if people are just honestly more open about their
Mm-hmm.
fertility and talking about it. And so
Yes.
it feels like
Mm-hmm.
more people have infertility. So I think it's a combination of a
Yeah.
lot of things.
I call it the social media effect. There's a social media effect on a lot of things because we are a social media world now, and more women are being more open about it and sharing their journeys. So you know more people because they're talking about it. So whereas before it may have been more taboo to talk about it, it's not as taboo anymore. And plus, the access to assisted reproductive technology has improved is being utilized and has improved drastically over the past several years. So now there's more women who are trying to get pregnant later in life. Whereas before, they just assumed they couldn't because they didn't have this technology. So I agree with you. I think it's a combination of all those factors.
Yes.
But I wish I don't know if there's ever going to be a good enough study to assess that because there's so many confounding factors, but maybe one day we'll know a real answer. Okay. So simple. Why does fertility decrease with age for women?
Absolutely. So the way I think about it is understand it physiology wise. So we are born with the same eggs we're going to have our whole life. And when we're born, our eggs are frozen in a genetic state. Actually, if you want to get nerdy, they're frozen in meiosis one. And it's when we are ovulating, whether we're 25 or 45, that our eggs get turned back on they finish meiosis. And what that means is they're sitting there with 2 copies of each chromosome. And when we ovulate, that is when they get rid of 1 copy of each chromosome, and they come and fertilize with the sperm that brings the other copy.
Mm-hmm.
And so eggs that have been in our body for longer don't work as well. More eggs as we age make more mistakes. And it just
Mm-hmm.
explains everything. It explains why it takes longer to conceive as we get older, why miscarriage rates go up, because the most common cause of first trimester miscarriage is a chromosome imbalance in the embryo.
Mm-hmm.
It's why fertility treatments are not as successful as we age, because there are just fewer good eggs as we age.
Mm-hmm.
And it also explains why, yes, of course, there are people in their 40s that conceive naturally. It's because they ovulate a good egg. Like, it doesn't mean all the eggs are bad. It's a numbers game.
Yeah. And just me as an example, I when I started IVF at age 40, I went through 5 rounds, and out of the 5 rounds, I got 16 eggs that actually made it to the genetic testing phase, but only 1 was chromosomally normal. I was never expecting that, but it just, I had the eggs. Yeah. They were not very healthy. So just for what you said, for the chromosome, and then when we tested it, there was a various different chromosomal abnormalities that would come out when all those eggs were being tested. So that was just based on my age. It really had nothing to do with my health status. It was just my age alone. So that is also what we call egg quality, meaning the quality of, and I don't know if it's right to say the DNA or the chromosomes within the egg, or it's just a poor quality as we age.
Yeah. And again, I just like to say there is a male age effect.
Well, wait, not yet. Oh, wait, that was the next question.
I was just transitioning for you.
You're transitioning, but I was gonna. Well, not, maybe I forget. Oh, but the other thing is this: it's not a definite for everyone. Every woman's different. Okay, so every woman's different. It doesn't mean that once you're 40, you're done. It just means that it's a possibility, and you really don't know until you try. Right.
Exactly. Yeah.
Right. Now, transitioning back to the men thing. We've traditionally heard that men can reproduce up until whenever. Right. Is there an age factor when it comes to male fertility?
Yes. So not every guy is Mick Jagger and delivering in their 70s.
Yeah.
Or Charlie Chaplin was like in his 80s.
80s, yeah.
Yep. So there's definitely a male factor, an age factor for men. It's not as dramatic as for women, or pronounced, but with age, there's lower sperm counts, lower motility, fewer of them are able to fertilize eggs, etc. But the biggest impact really starts in around age 50 or maybe late 40s. Yeah. And when guys ejaculate, there's so many sperm that there's a good chance that there's a couple of them that are good. And so it's just a numbers game. But with women, you're ovulating one egg each month. Right.
Yeah. And the other thing to consider also with men in the age is erectile dysfunction due to chronic medical conditions, whether they have high blood pressure, hypertension, or high blood pressure or diabetes that can affect, and they're on medications. It could be from medications they're on, or just because of the chronic medical conditions if they're poorly controlled. So that can be a factor as well.
Definitely.
So that's something to definitely consider. Okay, next question. This is going. What can men and women do to prepare themselves in anticipation of delaying childbearing or expanding family after age 35 and 40?
Great.
Yeah. So what could we do? Yeah.
Right. I think, honestly, we all know what we're supposed to do. It doesn't need to be complicated. We need to be healthy. So the healthier we are, and that is nutrition, and that is regular exercise. It is, getting good sleep. It's stress management. I do think about toxins. I think about that, decreasing exposure to toxins as a way to improve our reproductive health. But it's not some specific special diet that you have to do, or, some specific exercise routine. It's not a number on a scale. I mean, everybody's body is different. And I definitely think that, obesity is not as healthy, and it might impact your fertility, but there are definitely people that are overweight that are still having babies. And so there's no one size fits all for everyone. It's general, good, healthy guidelines.
Yeah. And I think, if someone's already anticipating delaying childbearing until later in life, that means they're planning. Okay. So you kind of know what's in the cards for you. So all the things that Dr. Shahine just mentioned, plus, and I say this every chance I get, if you have medical conditions, whether it be something diabetic, high blood pressure, any kind of vascular disease, cardiovascular disease, if you have some issues with weight control, start working on those and getting them under control. Because, you know, it could impact your getting fertility, but it could also impact your pregnancy once you do get pregnant. So, you know, one of the hardest things to do is get pre-existing medical conditions under control once a woman gets pregnant. That's not the ideal time to do it. So if you're already anticipating delaying childbearing, start working on all of those things, doing your routine healthcare maintenance, especially as you're nearing getting it towards age 40, because then what our routine screenings, they start to change. Meaning the number one thing we think about is breast cancer screening. So making sure that we get all of that done. So if you're already anticipating it and thinking about it, just make sure you do all the things that we just mentioned and get your health in as best tip-top shape as possible for pregnancy.
That's great.
Yeah. So, okay. Another one I always said, I get all the time. Well, my mom had my sister at 42. My aunt had a baby at 70. I'm exaggerating. She didn't. My mom had and my cousin had baby. You know, I'm not going to have a problem. Is fertility genetically inherited? If you have a super fertile family, does that mean it's going to apply to you?
Not necessarily. So, of course, you could have the same fertility path as your family, but it is not a guarantee. So you can't bank on it. And that goes for
and
the
don't assume it's
opposite
going
way.
to. Yeah.
You know, that
That
if you hear
yes,
your
the
whole
opposite way.
life that your mom really struggled with infertility or your sister had to do IVF, that does not necessarily mean that that's going to be your case too.
That's a very, very good point. So the reverse is true. And I do hear that. Not as much as the former one, but I do hear that one as well. Okay. Is there any test that can tell you exactly how many eggs you have and the quality of the eggs?
No. Would you like me to explain?
You can expect. And where I got this from is that someone had commented that she had gotten her fertility assessed and was told that she had the eggs of a 20-year-old and to not worry. And there was a lot of responses on that. Well, women thinking, oh, well, good, but we need to dispel that. There is not a test that anyone can do that can tell you how many eggs you have left that can be fertilized or that the eggs are normal. So you can go ahead and take it from there.
Great. So we all wish that we had that test. You know, we wish we basically had a crystal ball and could say like, oh, you have, you know, you're very fertile right now and you're going to be fertile for the next 5 years.
Yeah.
Like we wish that we could tell you that. The testing that's available to us right now is a snapshot in time. And it's a window into how many eggs are up for grabs each month and maybe quality. And so the information that we take is age. Age is the number one predictor of fertility. So someone can be 40 years old and have amazing blood test results, and they still can have difficulty conceiving. The blood tests that we have are FSH, follicle stimulating hormone, that's done on the 3rd day of the menstrual cycle. If it's less than 10, it's just reassuring that there are some good eggs there. If it's over 10, there might be a lower percentage of good eggs that you would expect for age. And if it's over 20, if the cycle day 3 FSH is over 20, that's significant diminished ovarian reserve, and it might be hard to conceive because there might not be very many good eggs.
Okay.
AMH is anti-Müllerian hormone, and that's probably the test that this person was talking about because it is a window into the number of eggs you have up for grabs in each cycle. Anti-Müllerian hormone is a hormone made by supporting cells around eggs. So the more AMH, the more supporting cells, the more eggs you have. Okay. So this is perfect for is predicting how someone will respond to fertility treatment. If someone has a high AMH and we do IVF, we're going to get a good number of eggs. And a good number of eggs means there's a higher chance, it's a numbers game, that there's going to be a good one. Now, a low AMH does not necessarily mean that someone's infertile. A low AMH might mean I'm not going to get very many good eggs if I do IVF, but that doesn't mean that they can't get pregnant. And there's a great study out of UNC that came out 3 or 4 years ago that finally answered this. It basically checked AMH levels for women who were planning to stop contraception, planning to try to conceive, didn't tell them what their AMH level was, and they checked in with the patients a year later. And the people who had a low AMH had the same chance of getting pregnant and having a baby in that year as people with a high AMH. So someone who, and very much in general, we're still gathering information. This is still, I mean, I know we've had this for years, but it's just not this like eureka test that we all want it to be. In general, when you're in your mid-20s, AMH is probably around 3 to 3.5. When you're in your mid-30s, it's probably around 2. And by the time you're 40, it's typically around 1.
Okay.
So a 40-year-old that has an AMH of 3, someone could tell her, you have the ovaries of a 25-year-old. That's where that can come from. But so that 40-year-old is a great candidate for IVF. But, if you're only ovulating 1 egg each month, and when you're 40, 80 to 90% of the eggs are going to be abnormal. You're still, it still could happen. But I think of a high AMH as a great candidate for IVF, not, oh, you're fertile.
Yeah. So in other words, if a 40-year-old had a high AMH, you wouldn't say, oh, you've got all the time in the world because you have eggs of a 30-year-old.
Absolutely.
Yeah. So that's a good point to make, because I hear that all the time, that my AMH is fine and I'm good. So the AMH again is not going to assess your egg quality. You could still have eggs, but the eggs may not be of a good enough quality to actually fertilize and result in a successful pregnancy. So as Dr. Shahine said, age is here. Age kind of dictates everything else. So your age is still a factor no matter what some of your blood tests are, correct? Especially as you get to the age 40 mark.
Yeah. And on the other end, just to, because there's a lot of people who are going to listen to this and be really worried that they have a low AMH. So a low AMH, like an AMH of like 0.1, like people have that. People with an AMH of 0.1, if they're still having periods and they have ovulation, they can still get pregnant.
Yes.
There's so many people out there that are not good candidates for IVF. Because if you stimulate them, they're only going to get 1 or 2 eggs, but that does not mean that they are infertile or that they can't get pregnant naturally. So it's just, you got to counsel the patient with everything in mind, not just a blood test.
Right. So along with the same lines with AMH, we talked about what is it, what does it mean? Now, and you said you referred to it's a snapshot. So it can vary at different points in time, right?
Yeah.
So someone had referred to it, the egg whisperer had referred to Dr. Aimee Evazadeh had called it the always meandering hormone. Is that true? It kind of like can vary from if you take it. Yeah.
I think of FSH, the follicle stimulating hormone, that has a lot more variation, and it can be really confusing because cycle to cycle, it could be 10, and then the next cycle it could be 12, and the next cycle it could be 8, and it just really drives people crazy. AMH is more consistent. But there will be some variation.
Yes.
Typically, somebody who has an AMH of less than 1, it's not that they check it in 6 months and all of a sudden it's going to be
perfect. Yeah.
Right.
I see what you're saying. Yeah. So we already talked about its reliability after age 35 and age 40. Again, age is still the most important predictor. And then someone had asked, if my AMH is good at 38, does that mean I will have no problems conceiving? And we answered that it doesn't mean you're not going to have problems, but it also doesn't mean you will. So, it's you have to take multiple things. I think the reason why I want to talk about AMH so much is because I think a lot of women that I see, they get so fixated on it. Yes. And they can be either really, really falsely reassured by it or really, really falsely devastated by it. And I feel like sometimes the devastation can really impact just your psyche overall.
Yes.
And they get that number, and that stress from that one number can also affect your fertility. Yeah. So we have to take it into consideration and really ask those questions about what does the AMH mean? And like this conversation we're having here, so that women are not devastated by it. Would you agree?
Yes. I don't want people to define their fertility by a number.
I agree. And I hear that all the time. I really do. So I'm sure you do
too. It's just hard because I also see like being that woman and getting that information and going to the internet and finding those charts that say enter your age and enter your AMH and we'll tell you when you're going to go through menopause.
Yeah.
I mean, it's so stressful, and you feel like you're being judged. You feel like, it's like you're getting graded, and it's like if you have a low AMH, then like there's something wrong with you, and it's like it's so emotional.
Yeah, it is. So I'm glad we talked about this and went through this a little bit more in detail, because it's probably one of the most common questions I get, and I'm not a fertility specialist, and I say, I don't know, go talk to Dr. Lora, go to her page. But I don't, but it's important that we discuss it, because I'm sure you get a lot of questions about it too.
Yeah.
Okay. Can a woman do anything before she hits age 35 to 40 range Is there anything she can do other than we talked about being healthy and all that? Is there anything she can take? Anything she can do to preserve her fertility in anticipation of delaying childbearing?
Not really. I mean, I think if you're going to take something, I think just a really good sort of prenatal vitamin, or multivitamin that's just going to have antioxidants in it, like vitamin C and vitamin E. And then vitamin D. Vitamin D is just, at least here in Seattle, it's already dark outside. And for us, it's like 4:20. So we have like no sun. And that can, just be helpful for overall health and immune system.
So all the things you just mentioned are things that are pretty simple and are found in just a regular women's health vitamin or prenatal vitamin. And I hear a lot about a gazillion pills or supplements, and I'm taking this and I'm taking that. And, I'm just going to go there. I think the people that are encouraging to do that, for most of the part, are not physicians. They're not fertility specialists. And we have to understand where that's coming from. And I don't think it's fair to some women to be told all that because they feel like they have to be taking that. And if they don't, they're never going to get pregnant.
Yep.
Talk to your physician and consider where that information, that advice is coming from, and understand that the supplement industry is a cash cow. And it gets a lot of money from women such as us who are trying over age 40. So talk to somebody like Dr. Shahine, who this is what her career is based on, to get her opinion before you start taking all these supplements. And I hear some of the things I hear that women are taking because they saw it on Instagram. We got to consider that too. And also make sure you're always letting someone know, your doctor, what you are taking, because supplements are considered, you're taking it into your body and you're ingesting it. You got to let them know that you're taking these things.
Right.
What are your thoughts on that? I know I'm going to make a few people unhappy by saying that, but I think
it's okay. It needs to be said because there is a real misunderstanding that, number one, that supplements are always good for you. There's a misunderstanding that if it's not a prescription, if it's in a health food store, that it's got to be natural and therefore safe. And like St. John's wort has been associated with high blood pressure. Even licorice has been associated with high blood pressure. And also something really important to understand is that this industry is not regulated. So if you buy a prescription, it's regulated by the FDA. There's spot checks. You know that what is in that pill is what is on the bottle, and the supplements, that's absolutely not true. So you have to be very careful where you source them. There's some independent companies that will actually go in and spot check, and like you can look for a little label on your supplements called USP. There are ways to find.
Yes, I've seen that.
But in reality, I think we're built to get our nutrition and our supplements and our vitamins from what we eat. Like truly, that's how we should be getting our vitamins, and that's how our body is meant to absorb them. And I don't like it when people are taking, a shelf full of supplements. It's such a vulnerable population. It makes them feel better. It makes them feel more in control of a situation that they feel out of control.
Yes.
But there are times where what's in there are phthalates in a lot of supplements. In the coverings, and phthalates have been associated with poor egg quality. So sometimes you'll find things in supplements that really shouldn't be there: arsenic, heavy metals, mercury. Things that you just have to be careful. Just because somebody says it's okay, you have to independently verify it, and more is not necessarily better.
I agree. Thank you for saying that. And I know it's not said enough. And especially with all the fertility specialists that are on social media that do not have the years of training that someone as yourself does, you have to consider where you're getting, who's recommending those supplements and where their training came from. And so you really did vet who you're listening to is what I'm trying to say.
And I really do want to believe that everybody's trying to help. I think when they put stuff on social media or recommendations, it's coming from a really kind place. I choose to believe that.
I hope so.
Just like when you're dealing with patients who are like, oh my gosh, I'm so, tired of being pregnant. What can I do to induce labor? And a friend will say, oh, I ate pepperoni pizza, and you make it real spicy. And then you'll go into labor. Like, Is that going to work? I don't know, but like
Yeah.
we're just trying to help, you know?
Yeah, yeah, I get it. So yeah, just make sure, make sure you vet where you're getting, any information you're getting, especially when it comes to medical information online. Okay. So I think it is age. Does having regular periods increase my chance of spontaneous pregnancy after age 35 or 40?
Sure. So if you're having regular, and what I mean by regular are predictable periods. So it doesn't have to be exactly every 28 days, but about once a month. If you're having regular, predictable periods about once a month, then you're probably ovulating.
Mm-hmm.
And if you're ovulating, you have an egg and you're able to get pregnant. And so that is great. If someone's having very unpredictable menstrual cycles, going 40 days, 60 days without a period, or having 2 periods in a month, that is a sign of irregular ovulation.
Mm-hmm.
And it might be really difficult to time trying, and it might delay you getting pregnant because it's just hard to figure out when you're ovulating and if you are ovulating.
Yeah, and along the same spectrum, I've told this story before. I had a young woman who was in medicine. She was probably in her late 20s or so, and she pulled me aside and she said, "Hey, I'm only having about 3 periods a year." And so I talked to my OBGYN and they said, "Oh, don't worry about it. When you're ready to have a baby, we'll just give you Clomid."
Yeah.
And I said, "Well, you got to find out why you're not having regular periods. A 28-year-old woman should be having regular periods. That's a first place to start. So if you're not having regular periods, don't brush it off, especially if you're young. You got to find out what it is that's not allowing you to have regular periods.
Right.
And if you feel like someone's not addressing that or is brushing you off, then you've got to find somebody who's going to listen to you so we can get to the bottom of that.
Right.
Yeah.
I love thinking about your menstrual period as like your 5th vital sign.
Yes. Yes.
Right.
Yes.
Like if you're, there's so many hormones that have to communicate and be in balance in order to have a predictable regular period. But if it's not happening, something's off, and it could be thyroid, it could be prolactin, it could be a couple of things. So why not figure that out and address that? And then it circles back to your very first point that you want to figure out what's not healthy or, align things so that when you are ready to get pregnant, it's easier.
Yes, I agree. Okay, so we talked about eggs and the reason why they're subject to our age. Is the uterus subject to the same age constraints? And if no, why not?
Great question. And the answer is it's because the uterus is absolutely amazing. And and there are people who are postmenopausal, meaning they don't have any eggs left, they haven't had periods for years. And we can actually give the uterus estrogen and progesterone and put an embryo in, and they can carry a pregnancy. And so that can be, the women in other countries that are 60 or 70 and having babies. They've created embryos with donor egg and sperm, and the embryos are ready. And then those women who've been menopausal for 20, 30 years, they've taken estrogen and progesterone to get their uterus ready. And this can happen to young women. I mean, young women go through premature menopause as young as in their 20s or 30s and still carry a baby and be mothers. It might just be with somebody else's egg.
Eggs, yeah. So I guess the uterus is a little bit cooler than the eggs are, than the ovaries are, and age is a little bit more refined than the ovaries do, which is a good thing. So that I was able to carry my babies through donor egg conception through in my own uterus, so it worked out for me. So the answer to that question is it's not subject to the same age constraints. So like Dr. Shahine said, you could still prime the uterus, and even if your ovaries are not working the way we want them to, and you could still carry a baby with the uterus.
I really appreciate that you share your story.
Well, thank you. I do every time I get, because the whole reason why I started this and I do these conversations is because, and we won't belabor it too much, but I just remember thinking I was 40, I'm an OBGYN, I'm a maternal fetal medicine specialist, I'm this real smart chick. And I was not prepared for what I went through. And I'm like, if I wasn't prepared for it, and I'm like, what the hell? What does the average woman who's not a physician think?
Absolutely.
So I knew there had to be some knowledge gaps there. And I was like, I've got to get the word out that this is something that we need to be talking about. Yeah. And then here we are, and we're talking about it.
You are doing an amazing job. Thank you.
Well, thank you so much. Okay. Let's see. Okay. And I get this question all the time. after how long of trying to conceive naturally, I'm going to back up. I'm not going to use the word natural spontaneously, because natural
Cool.
is implying that someone who is not it's unnatural, and I never want to make anyone feel that way. So
Cool.
if you're not able to conceive spontaneously after age 35, after age 40, how long should you wait before seeing someone such as yourself?
Sure. It's never too early. The American Society of Reproductive Medicine, which is our professional medical society, says if the woman is less than age 35, that they should try for a year, because 85% of people will conceive spontaneously
Within a year.
in a year of trying, if they're having regular, predictable menstrual
Right.
cycles. And if they're not, they should see someone soon. And then over the age of, starting at 35 or over the age of 35, the recommendation is to try for about 6 months. And the reason it's different is that there is a shorter fertility window if you're trying to conceive after the age of 35. And it's better to find out if there is an issue sooner rather than later. Yeah. And that includes doing something like a semen analysis. Like you don't want to try for a year or two and then find out that your partner has a low sperm count. So it's not just all about the women, it's having a complete fertility checkup to see if there's anything that could be addressed. It also doesn't mean that seeing a fertility specialist or having a fertility checkup, it doesn't mean that you are going to do IVF or you're going to do fertility treatment. It's just like, hey, figure out if there's anything that needs to be addressed. And if not, maybe you try for a little bit longer.
Yeah. And again, I say this every chance I get. Reproductive endocrinology and infertility specialists such as Dr. Shahine, this is what they do all day, every day. This is their life. And if you're wanting an answer and a workup about why you're not able to conceive or what your fertility reserve, that's the person to go to. Yeah. So, you want to go to the person that does it all day, every day. So I remember I had a person I was working with, and she was trying to conceive, couldn't conceive. Her husband went and go get a semen analysis. Finally, he did. And they figured out why. Yeah. And so the first step for any fertility workup is a semen analysis. So we can't just discount that there could be a male factor, right?
Absolutely. Absolutely.
Yeah.
30% of the time.
What percent?
30.
Wow. Okay. Okay. Well, I didn't know that stat, but yeah, I mean, so 30% of the time it could be due to the male. So, making sure, and then, and over age 40, how long should we wait?
As soon as you are thinking about it, because it's good to have a strategy. So especially if you're starting your family closer to 40, some people will be pretty aggressive and think about IVF soon, because you can use IVF as a form of fertility preservation. You can freeze embryos, even if you're conceiving with one. Like if you want 2 or 3 kids and you're starting at 40, if you conceive naturally and have a baby, that's fantastic, but it might be really hard at 42 or 43. Just it's the thought.
And one other point I wanted to make that was along something that you had said. One of the common misconceptions or things that I hear all the time is if they go to an REI specialist, they're just going to sign me up for IVF. And that's simply not true. There are multiple things they can do before they get to IVF, but the most important thing is to sit you down and figure out, is there anything we can do? There's been times where it's just a change in, making sure your diabetes is under control. Consulting with an MFM as well. It's, to see if there's any pre-existing medical conditions to get you ready for conception. It could be, just testing differently. It could be, something that's really non-invasive. So going to someone such as Dr. Shahine does not mean they're putting an IVF stamp on your forehead. So please don't think that. It's not true. These guys are very well educated on all things around women's reproduction. And there's been many times where they just went and had a conversation in one consult, a couple of recommendations, and they conceive naturally or spontaneously.
Absolutely. Or sometimes I'm talking to people and they're already pregnant and they find out later. I'm like, yep.
Yeah, you're already pregnant. Yeah. I did it really just like that.
There's a reason that rumor is out there. There are just good and bad out there. And so if you do feel that, or you feel like someone's like, not listening, just pushing a plan on you without taking everything into consideration, then maybe talk to someone else.
Yes, get a second. You can always get a second opinion. Okay. So what is the role of Clomid and or IUI after age 35, and why? This is the question. Why does it seem like this is always the go-to?
Sure. So there's basically 2 options with fertility treatment when you're trying to conceive with your own eggs. It's either low tech, which is, Clomid or letrozole and IUI, or IVF.
Mm-hmm.
So the reason that it's a go-to is that it's less invasive, it's less costly, it's controlling some variables, and if you conceive with a simple treatment like Clomid or letrozole IUI, then you don't have to do IVF. But that's why it feels like a go-to, because if you aren't conceiving on your own, this is something that might up the chances, because the only other real option is IVF.
And along the same lines, like, is there a magic number of IUIs that you would recommend before, like, or like stopping? Like, how many
Yeah.
is too many?
Yeah, great question. So it totally depends on why the couple is doing IUIs. So if someone is a same-sex couple or a single, planning to be a single mom, and they're using donor sperm IUI, they might do, 6 or more IUIs before they think about doing something like IVF, because they're not infertile, right? If someone has been trying to conceive for a year and they've had testing and everything seems pretty good, it's kind of unexplained. Well, an IUI is really helpful. It might up the chances, but you don't want to do an IUI for 6 months to a year, because in general, if an IUI is going to work, it will be successful within the first 3 tries. So that's what studying other people has shown. That doesn't mean that someone would not conceive on their 6th or 10th IUI, but the tipping point for kind of your typical couple that's been trying on their own, but it just isn't working, is try IUI 3, maybe 4 times. And if it just doesn't work, you really should think about IVF.
Oh, but I also think too, I've seen this. I did a gazillion IUIs, and I should have just used that money towards IVF.
Sure.
So, you got to also consider what your nest egg is. I don't know what else to call it, for these fertility treatments. How much money do you have? And for some women and couples, it may be more financially reasonable to go to IVF sooner than later than to use up your money in IUI. So that's always something to consider as well. Would you agree with that?
And think about the strategy too.
Yes.
So again, if someone's like 42 and they want 2 kids, they probably shouldn't do IUIs if they're able to do IVF and freeze embryos. So you got to take the whole picture and strategy into consideration.
Right. Okay. There's another question. There are so many, and we talked about this a little bit. There are so many holistic naturopathic remedy supplements that say they improve egg quality and quantity, but a lot of egg quality supplements, like antihistamines, allergy meds as well. Does any of this stuff work for egg quality?
I mean, the jury's kind of still out. There's certainly some studies, mainly in animal models, that show some benefit to certain things like coenzyme Q10, sometimes DHEA. But, there are studies that say it doesn't really help. And again, you have to really be careful about the source and, really kind of talk through pros and cons about taking different supplements.
And make sure someone's, I don't know what the right word is, as managing you. If you are taking DHEA and CoQ10, make sure someone's advising you, like a physician, it's on how to take it and knows when you're taking it, right?
Yep, exactly.
Yeah, it's really important. In other words, it's not something you should just go and do on your own and just pop the pills and, you got to make sure someone is managing you taking this.
Exactly.
So what is DHEA? What does it do? Who should be taking it?
Great. So it is basically a male hormone. So it's a hormone that's made by the adrenal glands and the ovaries. It is something that does decrease with age. And so the thought was, if you could replace lowering DHEA that's usually made by the ovaries, maybe that will help improve the egg number and egg quality of women who are going through IVF. The biggest proponent of this was Dr. Gleicher in New York, and he did do studies on it and did show through some studies some improvement. And about, 5-7 years ago, people were like, wow, this is amazing. This is it. This is what we've been waiting for. And then when you then did bigger studies, it's kind of like, oh, it really doesn't help everybody. And gosh, certainly people with PCOS or people with like already high male hormones, that's actually not good for them, and they should not be taking it. It's actually counterproductive. So, and then there's some side effects with it, like there's some acne and oily skin type of things. So It's not the, the holy grail of
Yeah.
something that we wanted it to be.
Yeah. So for DHEA, I have been messaged by a lot of women who just take it on their own.
Right.
Would you agree that you, like I said before, that someone needs to be managing you while taking the DHEA?
Yep.
It's not just something you should be doing on your own. Yeah.
Right. Everybody should know. Some women have found that if they take high levels, and I would consider a high dose 75 milligrams a day, that sometimes it actually throws off their ovulation.
Yeah.
So it's sometimes I think it's a good supplement to consider for someone with significantly low egg supply who's planning to do IVF. But just to be out there kind of taking it and not being monitored or not being under care, you certainly don't want to take something that's going to harm your chances of getting pregnant.
Yeah. Okay. Good information on DHEA, because I get questions about that all the time, and that's not my wheelhouse. I don't answer them, but yeah, I'm glad. I'm going to refer them to this video. Okay. Another good question. Can being on long-term birth control affect my fertility negatively, or can it preserve my fertility?
Great. So it does not harm your fertility, and it does not preserve your fertility. So some people would think like, oh, okay, the way birth control pills work are it prevents me from ovulating.
Yes.
And so that's why I'm not getting pregnant. So if I'm
Yes.
not releasing an egg, then I must be storing them up.
Yes.
Unfortunately, that's not true.
Yeah.
We're losing hundreds and thousands of eggs every month, even if we don't ovulate.
Yes.
Now, it does not harm your fertility. And I think that one of the reasons that this comes up is that it can mask ovulation issues.
Yes.
So people who are taking birth control pills are getting regular periods because the pills are giving them periods.
Yes.
Your ovaries aren't working. And so you're building up a lining with the estrogen in the pill, and you're shedding it when your uterus doesn't see estrogen or progesterone anymore. But when you stop the pill and your uterus isn't seeing that anymore, your ovaries have to start to take over. And if your ovaries aren't working, if they aren't ovulating, then you could have irregular periods, difficulty conceiving, and it can even mask premature ovarian failure or premature menopause. So people come off the pills, they're not having periods, and they're convinced it was the pills that messed up their periods, when really it was just masking an issue that had been there for who knows how long.
Yes. And then we have to also consider why we were taking birth control to begin with. There could have been some issues with the periods and irregular periods, so there could have been something that it was treating to help us regulate our periods more. So the good news is it's not going to hurt your fertility, but it's also not going to bank your eggs for you, unfortunately, because we still are going to lose the eggs. Okay. Okay. Why is there an increased chance of multiples with advancing age? Because spontaneous multiples.
Yeah, because the ovaries get a little bit more dysfunctional as they get closer to premenopause and actual menopause. And sometimes the ovaries are more likely to ovulate 2 eggs as we get into our 40s. And so if they happen to be 2 good eggs, there's a higher chance of twins.
And then along the same lines, what is a perimenopausal pregnancy? This is on TikTok all the time, where women thought they were going through menopause, and bam, they get pregnant. So there is such a thing. So what is the perimenopausal pregnancy?
Sure. So menopause is not having periods anymore because you are not ovulating any more eggs. Perimenopause is the 5, sometimes 10 years before actually menopause, where you still are having periods, you are still ovulating. You're probably not ovulating good eggs most of the time. It's very unlikely to get pregnant. Your periods can sometimes be spaced out, like you might skip a few periods and things like that as you're really getting closer and closer to menopause, and they're sort of dysfunctional. And so if someone's ovaries are not ovulating on a regular basis, they're having irregular, unpredictable cycles, they could think that maybe they're in menopause because they haven't had a period for 6 months, and they're close to 45, 50, whatever. But then boom,
they're pregnant.
You actually ovulate before you have a period. So you could be like not having a period for 3 or 4 months, ovulate, happen to have sex, happen to have a good egg, get pregnant, and then a month or two later be like, wow, I really haven't had a period for a long time, and then find out that you're pregnant.
You're pregnant, yeah. So and menopause is when a woman has not had a period for a year or more, right? Okay, that's
right.
good. And you're in the menopausal age range.
Right.
Is
Well,
what that be?
I mean, it can happen,
Or like early menopause, yeah, for early
right.
menopause.
It's
So yeah, I can.
not having a period for a year because you don't have any eggs left.
And legs. Okay. Okay.
Right.
Gotcha. Okay. So let's do. We're gonna do two more questions, and then I'm going to try to answer some. We didn't get to everything, so we'll do a part two at some point. Let's do some straight talk about spontaneous conception after age 40. And we've already talked about it piecemeal through this conversation. If you had a woman come to you after age 40 and she's like, listen, what are my chances? What do I need to know about spontaneously conceiving after age 40? What would you tell her?
Always a chance, less than 5% each month.
Okay. So, and that's what happened with me. When I went, when we first started trying to get pregnant, I was 39 and a half. I had a miscarriage on my own. And then I got melanoma. So that delayed a few more months. And then right after that, I freaked out and we went to our fertility specialist, my friend. He showed the graph to myself and my husband about hit the floor. And we went straight to IVF because he had a straight talk with me. He said, listen, we can do, you can try on your own, but this is what the stats show. And, I don't know what would have happened had I tried on my own, but I do know that I didn't have a lot of eggs. Well, I had one good egg left that I know of. So that was the right path for me, was to try the IVF. But talking to someone about the straight talk after age 40, especially if you're not having regular periods to begin with, is extremely important. And I would recommend, and you don't have to agree with me because you are a specialist, but I do recommend when you're hitting age 40 and you want to get pregnant, I would always see an REI straight off.
Yeah,
I would.
I agree. And you and I both did OBGYN residency.
Yeah.
So we did that for 4 years. And then you and I subspecialized, did a fellowship after that. But in those 4 years, an OBGYN residency, I did not learn about fertility. And every program is different. Yeah. But a lot of primary obstetricians and gynecologists, fertility is just not their, bailiwick or whatever term you want to use. Not what they
they don't do it every day. They don't do it every day. They're a general OBGYN. They do all things gynecology, obstetrics. They do it all. If you're getting age, in your late 30s, early 40s, go straight to the REI.
Yeah, I totally agree.
Okay, good.
Doesn't mean that you do IVF, but you're just going to get, truly an expert opinion and someone that does it every single day.
I agree.
Yep.
Okay. Is there any benefit to freezing your eggs after age 35 to 40 and even after 40?
Yes, but with realistic expectations. That as we age, we have to freeze more eggs because fewer of them are going to be perfect, and there's a lower chance of success whether you're freezing your eggs or doing IVF after the age of 35 or 40. So the thing about egg freezing is it's an amazing, empowering choice. And you're freezing eggs. The thing is you don't know if they're going to work until you use them. And so that's the scary thing. And we just know that if someone is 40 years old, it might take, whether they're doing IVF and trying to conceive right away or whether they're doing IVF to freeze their eggs, it probably takes, 10 to 20 eggs to have a live birth.
Yes.
Because there's attrition. Not every egg is going to fertilize. Not every fertilized egg is going to be a normal embryo. And so it absolutely can happen. It's just you really have to have a very real conversation with the IVF doctor about how many eggs should I freeze to feel confident or comfortable that it's going to be successful in the future.
Yeah. And like you said, there's going to be an ideal number of eggs to have in the bank, if you will, for anyone freezing eggs. But the older you get to freeze your eggs, the more cycles it might take to get to that ideal number.
Exactly.
And so you need to be prepared for that. Be prepared for that. Okay, so let's go through and answer some questions. We have about 10 minutes left. We're not going to get to all these questions, so I'm sorry. If we don't get to your question, if you put it under the comments under this video, we'll do a part 2 and we'll answer questions. Let's see.
This has been so much fun.
It was fun. There's a lot of hellos. Let's see. Can someone with autism have a baby without birth defects?
Yes.
Mm-hmm.
Yeah.
Go
we
ahead.
don't know about really truly a genetic link with autism. It's possible, but it's more likely that it's kind of multifactorial, like multiple reasons.
Mm-hmm.
But just because someone has autism, it doesn't mean that their offspring, their children, will have autism.
Agreed. Yeah, right. Does medication such as Zoloft taken by the male affect male fertility?
Um, you know, studies vary and probably not. I think that, when it comes to mental health and wellness and emotional stability, it's pros and cons for everything, whether it's
Mm-hmm.
women or men taking medications. And in general, I think that taking care of your emotional and mental health is extremely important. And
Yeah.
just it could be one factor if there's a low sperm count, but not always. And I really hesitate taking people off of those meds.
So I agree, and I'm so glad you said that, because what couples and men and women have to understand is that the effects on fertility and and especially in pregnancy of not being on medications if you need them can be just as severe or more severe than if you're or as if you're taking a medication. You have to have your mental health and emotional health under control. So just for pregnancy, a woman who has mental health disorders and they're not medicated, or if they need a medication, that can be more dangerous to the pregnancy. So I understand and I get that we don't want to take anything. We don't want to take this, but there are certain conditions that you have to take the medications, and it's not going to be recommended that you come off of them for trying to conceive or pregnancy.
Agree.
Okay. Is metformin a long-term option for PCOS? Are there any side effects? How could it affect someone trying to become pregnant?
Sure. So metformin is a medication that helps your body use insulin better, and insulin resistance and insulin dysfunction is really common in PCOS. And so for some women, when they take metformin, it will help their insulin work better. They'll even start ovulating more regularly. Insulin is intimately involved in ovulation.
Yes.
But a lot of people won't. So I think it's maybe 10-20% of women who have PCOS and irregular cycles will actually start cycling regularly with metformin. So, 20 years ago, it was just your go-to. Anybody that had PCOS that had irregular,
Yes.
start them on metformin, and then you wait 6 months. And then if they're not having regular periods, then you start maybe doing ovulation induction with Clomid or Letrozole. And that's really different. People are much more apt. There's a great randomized control trial by Richard LeGros showing that metformin alone is really not that effective at inducing ovulation and regular cycles in people with PCOS. So we don't have to make people wait that long.
Yeah, gotcha.
Yeah.
Okay. I have been taking CoQ10 to increase my egg quality. Is this a good thing to do? We already touched on that, but the short answer is
maybe. Yes. I think that I haven't seen studies showing a harm. It's a powerful antioxidant. It can be helpful in lots of health reasons, and there are pretty good studies showing improved egg quality and sperm quality with CoQ10.
okay. Another one on CoQ10. Do you know anything about a Pregnitude drink supplement for egg health? Pregnitude. I don't know what that is.
I don't.
But I would pretty much say that if it's a shake or a drink, it's not going to have been tested. There's not going to be any studies that show that it works.
Yeah.
I mean, I don't know, but I don't know what's in it. Yeah.
Yeah. Usually what companies are doing are they're taking pieces, they'll make a shake and they'll put like folate in it, and they'll basically say, see, this is good for pregnancy because this is what you would find in a prenatal vitamin, or they might put like, vitamin D or, B vitamins and say, this is what you need. And it's pretty good marketing, but there's ways to be healthy.
Yeah. Yeah. I agree. Just turned 35. I was recently diagnosed with an underactive thyroid and had two miscarriages. One embryo tested was normal. Could my thyroid have been the issue? If your thyroid disease is under control and your TSH, free T3, total T3, free T4, total T3, or free T3 are under control, that shouldn't be why you're miscarrying. So what she said, I heard this question, and we're going to run out of time. We might even get cut off. If we get cut off, I'm sorry.
Cool.
People think that if they have PGS tested embryos that are normal, that should not result in a chemical pregnancy or an embryonic demise or a miscarriage. And they don't understand, well, my genetic testing on my embryo was normal, but that can happen, right? Because there's multiple factors involved with getting pregnant and having a successful pregnancy. Now, although chromosomal abnormalities are the most common cause of early miscarriage, it's not the only cause of early miscarriage. And sometimes it just happens. So if you have a chromosomally normal embryo that was tested, it could still result in a pregnancy loss, right?
10% of the time. Yes. Every clinic is a little bit different. And a normal, I hate the word normal. I mean, it's embarrassing what we're testing. We're literally making sure that there's 23 matched chromosomes. And there's 10 to 25,000 genes on each chromosome. So just because the chromosomes are matched, it does not mean that it's a normally genetic.
That's a whole nother conversation. We know the chromosomes are normal, but there's a whole lot of things within each chromosome that could not be just perfect that can cause it too. So, let me just say this to your audience. You know, if you miscarry a PGS tested embryo, that does not mean that there's automatically something wrong with you. It can still be the embryo. And I just can't say that enough. Gotcha. Thank you. Okay. My GYN surgeon said my tubes might be blocked. What test can be done to figure that out?
Sure. A hysterosalpingogram, HSG, is a test to flush the fallopian tubes and take pictures to make sure that they're open.
So the HSG, sometimes though, putting the dye through, it goes through the cervix, out through the tubes, and you do pictures to see that the dye is coming through the tubes. Sometimes the HSG can flush a blockage.
Right. I think of it like kind of like maybe there's mucus plugs or little cobwebs, and it just sort of helps flush. People are more fertile for about 2 or 3 months after the HSG. I would never use it as a treatment. But sometimes that's kind of nice to hear if you're nervous about it, because it can sometimes be crampy and people read really, negative things online about it. It's an excellent test and really, really helpful.
So along the same lines, if an HSG shows your tubes are blocked, are they always going to be blocked? Can they unblock themselves or?
There are cases where people get pregnant spontaneously after having an HSG say that their tubes are blocked. And in that case, I think the test was wrong, that maybe there was cramping and the uterus kind of clamped down and didn't let the fluid come out. I think that happens extremely rarely, and you have to believe the test, that if the test says the tubes are blocked, you have to assume that they're blocked. But no test in the world is 100% perfect.
Exactly. Good. Yeah. Let's see. Okay, how frequently should you have sex when trying to conceive? This is going to be our last question.
About 2 or 3 times in the week of around ovulation.
Okay, so we don't need to have it 5 times a day.
No.
We don't need to have it every day.
No.
Right?
But
and
if
why
you
is
want
that?
to, that's not bad.
Everybody
either.
thinks more is better. If you want to, if you want to, that's there. But people think that increases your chances.
No.
Does it increases your? Yeah. It doesn't increase your chances, right?
Yes. Sperm lives in the reproductive tract for about 96 hours. So even after intercourse, it's there and looking for the egg for, 96 hours.
Can we just answer that? Okay, let's see.
In case you get cut off, I really love this.
Oh, well, thank you. This is a lot of fun. Yeah. Okay, we got 1 minute and 30 seconds. Do you recommend IVF for recurrent pregnancy loss or recurrent miscarriages?
It is an
For
option.
it depends on what the cause is. You got to kind of figure out what's going on. Yeah, go ahead.
Right. But the most common cause of first trimester miscarriage is a chromosome imbalance. So you can use IVF as an embryo selection tool, but it just takes really good counseling, because most people that are having miscarriages will have their family without intervention. It is an option, but it's not the only option.
And one thing with recurrent pregnancy loss, it depends on when the pregnancy losses occur, because a lot of the causes for early pregnancy loss are not necessarily the same causes for if you're having pregnancy losses after 12, 13, 14, 16 weeks. Those could be 2 very different things. So if you're having recurrent pregnancy loss or miscarriages, you need to see an REI, and you need to see someone like myself, a maternal fetal medicine specialist, to figure out if we can jointly decide or figure out why you're miscarrying. Because there's a lot of things that can cause, and it also depends on when you're losing your pregnancies.
Agree.
Okay. All right. We got 30 seconds. Thank you so much. We're going to do a part 2.
Okay. That
This is a
sounds
lot
great.
of fun. Again, if anybody has any questions that I didn't get to, comment under this video. It's going to be in my Instagram stories and our Instagram feed. And we'll just do a question and answer session next time. How about that?
Thank you so
Yeah, from the
much.
audience. All right. Thank you so much for doing this. I appreciate
It's really
it.
fun.
Bye.